Please welcome April.
Thank you very much. So the topic that I'm going to cover tonight is prescription drug abuse and actually prescription drug safety. As I think we would all know, prescription drugs can absolutely be literally a lifesaver. There are certain people that have medical conditions and they really literally wouldn't be able to live day to day without the medications. We're not going to talk about that. What we're going to talk about are the potential dangers that are inherent in taking medication, either recreationally, as some of our young people and adults do, or otherwise as prescribed. Either way, they can be dangerous, and we're going to be talking about that. So why would I be interested in prescription drug abuse? Two words would tell the story on that, and they were, he's gone. Unfortunately, we lost our 21-year-old son, Joseph John Rovero, also known as Joey, III, to an accidental overdose of prescription meds while he was a college student at Arizona State University on December 18, 2009. Joey was a graduate of Cal High here. We went through middle school, high school. We're in the senior year of college, about 4 months away from graduation, when we got that devastating news that Joey had been found in his off-campus apartment. And basically, he hadn't survived a simple gathering with his friends. It was a full-blown party that they had been out celebrating the end of finals, the end of the semester. All of them were going to disperse the next day to go back for, to their homes for winter break. And of course, we were expecting Joey to come home too. We had to literally bring him home in a coffin, and it was devastating. It still is. It's been almost 9 years and going on 10 now since we lost him, and I will tell you every single day I miss him tremendously. So the bottom line and the key here to my work in the prescription drug abuse field, prevention field, is that I wasn't educated as a parent. I thought I was one of those super parents that went to the parent ed things. I thought I was having those right conversations with my child, but I didn't realize that prescription drugs could be used recreationally. I didn't know that. All I really knew was that painkillers could be addictive, and they are. I didn't know that very little could actually take your life. Joey died from a single pill of Xanax mixed with a pill and a half of oxycodone, which is a painkiller, and he mixed a little bit of alcohol with those combination drugs. That's all it took to take his life. He went to bed after being out with his friends, and he did not wake up. And left a family and a community that's really devastated because of his loss. I want to share with you what I've come to know, and that is that we have a national epidemic. Prescription drug abuse has become rampant. It happens very easily when you're prescribed medication and maybe you stay on it too long, in particular the painkillers that are so frequently prescribed. Overdose is now the leading cause of accidental death, and that's shocking to me, even still. It used to be car accidents, no longer. It's overdose deaths. And as you can see on this chart, over 70,000 people lost their lives this last year, 2017, the last year on record, at least for data, to a drug-induced overdose of whatever sort. But at the same time, over 40,000 of them were from opioids, either prescribed painkillers or their equivalent, which is the illegal drugs we see out on the street all the time, heroin, fentanyl, carfentanil, very powerful opioids. And when they're created, synthetically or whatever the case may be, they are typically mixed, by drug dealers with other kinds of things like fentanyl, which is so powerful, even a little speck can literally kill you, or you can ingest it, breathe it in. You can take it in through your skin. It's really scary. So I think it's really important that we think in terms of people. It's easy for me to do that because I lost my son. But every single one of these photos represents a family that is devastated, a community that's been impacted. Those numbers are real people. And they're not just somewhere else. They've happened right here. We have had at least 30 deaths over the last few years here in the Samaritan Valley. And in fact, yesterday, I woke up to the devastating news that a young man, we believe, died from an overdose right here in a Safeway parking lot. And that's not something that we'll probably hear more about other than those of us that are working in this field and we have some inside connections. But those deaths happen here. It's not just somewhere else. Every one of these people, and I have 650 or more photos from around the country now, people who've submitted the photos to me, so I can try to get education out there about this. These are real people and real losses. And there are no boundaries, so often I'll have parents say, well, my kids, we're fine. My child is a high-performing student, excellent grades, or they're very, much into sports and they're keeping busy with that. But I will tell you that isn't necessarily, those aren't protective factors necessarily. What about the student who gets injured, gets taken to the doctor, and for that injury, which is probably painful, they get prescribed medication, painkillers? What if their body reacts to it in a way that not everybody reacts to it, and that they like that feeling, and they want to stay in that condition forever. They love that feeling. They may continue to take it longer, the painkiller longer, and end up dependent on it and ultimately addicted. And that's when really bad things can happen. So bottom line is, even little kids, we're having overdoses and poisonings, let's call them, with little grade school kids or maybe even toddlers who get a hold of these really pretty pills that look like candy. And they take them down and they overdose, and hopefully there's an adult there, real close by that can get the attention they need, and they don't succumb to that, but not always is that the case. And our elderly people, they sometimes forget they take their medicine, or maybe they have multiple medications and the combinations don't work well for them. So anyone can be impacted by this. There's a common misconception we have to break down, so consider this a wall, right? The perception is, hey, a doctor prescribes them, so they're not harmful. How can that be? We'll just follow the directions and we'll be okay. Usually that's the case. But what if you have an underlying medical condition, or other things, or maybe you double up on your meds, or you mix it with alcohol like my son did? It isn't necessarily, going to work out okay for you. So those are really the case. And don't think that you're not impacted. We have people breaking into cars, smash and grabs, they call them. Get whatever you can out of that car, go sell it quickly, and go buy your drugs. The drug you become dependent on, and if you don't have, you're going to go in withdrawals, and you're going to feel horrible. Your job every single day becomes, when you're addicted, to go get that drug that you need to keep yourself, just even kill. So we have crime that any one of us could be affected by, broken, cars that are broken into, homes that are broken into. We also have addiction, and that's such a strong problem in our area and really everywhere in the country. We have it's either 2 or 3 million people that are addicted just to opioids alone. And that is really difficult to manage. Not just that person has that addiction, but the whole family, or everyone that loves that person is really miserable. They want to help that person, and only they can help themselves. So it becomes a very difficult thing for families to deal with. It's easy to avoid, we just don't get there in the first place. So that's why we work on the prevention things that we do, which is really education of all the youth and adults in our community that we can touch. Drug driving, any one of us can be out there driving any given day in a car. We aren't the problem, but we run into somebody who is impaired. And the financial cost to our country is enormous for this problem. So the drugs that I want to make sure everybody knows that we need to be really, really careful with would be the painkillers, the sedatives, and the stimulants. And you can see what the effects are. All of these are addictive. So don't think of Xanax, for instance, which we understand is a drug commonly really being abused on our high school and our college campuses. It's way more than just a chill pill. It is, you become dependent on it pretty quickly, and potentially addicted to it. And I know people that really struggle to come off that particular drug. Painkillers, easy to remember that one. Painkillers can kill you. Again, if you take too much, if you mix them with alcohol, if you mix them with something like Xanax, a sedative, they become more powerful when mixed together. There's a multiplier effect. So we have to be super careful about how we combine our medicines. Another drug category is the stimulants, and stimulants are often abused by our high school students and our college students. If you do not have ADHD, a condition that these medications actually work well for some people, it helps calm them down, it helps them focus. Someone who doesn't have that condition, it has the opposite effect. Their brain reacts differently and it ramps everything up. So you can see that you can get into big trouble with those too. One that I'll mention too is cough medicine. Some of our teens like to drink a lot of cough medicine. The stuff over the counter has alcohol in it. If you drink enough of it, you can get a little bit of a high. If you drink the cough medicine that is prescribed, it has codeine in it. That's one of our sedatives. And so it can actually cause some real big problems, as you can see here too. And then we've got the fentanyl. Fentanyl is being manufactured primarily over in China. It makes its way over to us through the Mexican border, but also direct mail. You can order it online and get it here, and once it's here and it comes in typically powder form, it's showing up everywhere. Our teens and everyone really needs to, we all need to understand that it's showing up in cocaine. So if somebody's out there abusing that drug, fentanyl may be in it. It's showing up in all sorts of forms. Marijuana is being laced with it. It can show up as fake pills, and you can see that in the lower left. These pills are so convincing looking that even the experts don't know the difference. So we're certainly not going to be able to tell the difference. The big story here is, first of all, don't be abusing the illegal drugs, because right now fentanyl is very much out there. Secondly, don't take a pill unless you know it came from a legitimate pharmacy. A lot of our pharmacies online look good in terms of their websites, but they're fake ones, and they are sending this kind of stuff out. So please, please be careful. Pill parties, we have those out there. We hear about them now and then, and that's where kids come together, and each of them is robbed from their medicine cabinets, who knows what, and they're thrown in a bowl mixed with each other. People are grabbing them. Alcohol is very often in the mix, and you can imagine the danger there. Don't want to do that. In terms of action, it struck me that we have probably the biggest wall involved in this situation, and that's called stigma. It's because of stigma that people don't necessarily go out and get treatment. They don't want to admit they have a problem. They don't want to out themselves to their family. What I want to say is we can break that stigma. All of us today, individually can break that stigma. Don't think of somebody with an addiction problem as somebody that has a moral failing, and if they could just fix themselves, they would. They make that choice. Once you're addicted, you really don't have a big choice. You have basically the choice of getting clean and getting treatment. Really hard decision to make, and it often, even in treatment for 30 days, does not work. Come out, maybe start using again immediately. But stigma causes us not to get the treatment in the first place. It also results in the fact that we don't have enough treatment facilities out there. So that wall has kept us from getting where we need to be to consider this as it is a health issue. And just like diabetes or any other health condition, we need to have treatment available to anyone who needs it and wants it. So that is a huge wall. We also need to get those medicines out of our medicine cabinets. My challenge to you today is to go home and take a look at what you've got in your own medicine cabinets. Are medicines expired? Are they just hanging there because maybe I'll use them someday? Maybe that painkiller will be needed. You know what? You can always get more medicine. Please lock them up if you need them and dispose of them properly if you don't. Most of our police stations, all of them in our area have them. Bins that you can just walk in, drop off your meds. All of the CVSs have them, and I think Walgreens will have them in their pharmacies soon too. It's easy to get rid of them. Do not flush them, because that is going to be harmful to our environment. Eventually that stuff makes its way to our water system. The other thing is learn the overdose signs, and here's a great example of them. If you think somebody is overdosing, please don't run, young people. We now have a good Samaritan Law that says you won't be prosecuted yourself, even if you're under the influence. We need to save lives, so make that call. This is a naloxone rescue kit. I would challenge all of you to get a kit. Even if you don't have a problem in your family, it doesn't matter. At any given time, we can be walking around town and we can encounter somebody that's overdosing. Had somebody seen that young man yesterday morning in his car and he was not looking like he was with it, there was a possibility of turning that overdose around had we had these kits. They're now available in our state of California, over the counter, in any pharmacy that carries them. We're working on getting all of them to carry it, but call in advance and just see if they carry naloxone. Otherwise, you can get a kit by just getting a prescription from your doctor. That's also legal now, to get a prescription to use that medication for someone else. Asking questions, when you go see a doctor, I also challenge you, please just ask, what are the side effects of this medication? Is it potentially addictive? If so, hey, wait a minute, do I have a family history of addiction? If so, you're more at risk. Even if not, find out. Challenge your doctor to find other alternatives for you, and there are those other alternatives, and here's an example of some of them. Pain issues and anxiety or sleep issues. So there is help out there. Recovery is possible. And so the key is, especially for young people, the sooner the addiction, if it's starting to take hold or a dependence is identified, ask for help. And here's a great phone number. This is a 24/7 hotline that can be called to find treatment in your area. And then we can also be contacted. We present at schools. I'm out in my Greek health classes all the time. Last week it was Dublin. I'll be out at Monte Vista High, Cal High, other classes in different schools around the area. If you have a group that could use this information that I've shared, I'm happy to come out and speak. So please take down the information here and give us a call if you need us. Thank you very much. Appreciate you listening.